Ever laughed, sneezed, or jumped and noticed a little leak in your underwear? You're not alone. But it's not normal, and it's not just a mom thing. This is known as stress urinary incontinence, and in today's video, we're going to discuss what is stress urinary incontinence, why does it happen, and what can you do about it? Hi everyone, I'm Dr. Nabila Noor, a urogynecologist and a pelvic reconstructive surgeon, and welcome back to my channel. If you're new to the channel and like what you see, don't forget to hit the subscribe button and share this video with a friend. Believe it or not, 1 in 3 women suffers with urinary leakage, and yet we don't even talk about it. So do me a favor, share this with a loved one or a friend or a colleague or a neighbor. Trust me, they'll be grateful that you cared about them. So without further ado, let's get started. Let me start by telling you about my patient Sarah. Sarah is 35 years old. She has had 2 babies. They were pretty large babies, and she had a pretty traumatic delivery with need for forceps. Now, after she recovered from her deliveries, Sarah started to get back to being more physically active, starting Zumba classes that she used to love. But guess what? Every time she was doing any high-impact movements, Sarah noted that she would leak in her underwear. It was getting so frequent that she now was starting to wear a pad all the time. And it embarrassed her because she was worried that people around her could smell the urine. And guess what she did? She stopped doing Zumba or any other exercise for that matter. All her friends and family members told her, oh, this is so common for a new mom. But Sarah felt that she wanted something different for her body and for herself. That's when Sarah came to meet me, and as a urogynecologist, I'm going to tell you what I told Sarah: this is not normal, and your body deserves better. So let's start with, what is stress urinary incontinence? Stress incontinence is when women have leakage of urine due to increased pressure in their abdomen or their belly. Now, this increase of pressure could be with things like laughing, coughing, sneezing, exercises, jumping. Think about anything that puts that extra pressure on your belly. That pressure gets transferred to the walls of the bladder gets squeezed. Normally the urethra, which is the pipe through which urine comes out, can stay closed, and as a result, even though your bladder gets squeezed, urine doesn't come out. But what happens in women who have stress urinary incontinence is that the pelvic floor support for your bladder and urethra has gotten weak, and as a result, they're not helping close the urethra. So if you think about my fist as the bladder, which is the organ that stores urine, and my finger is the urethra, which is the pipe through which urine comes out, normally there are muscles under the urethra that helps support it. And also there is a special kind of muscle around the urethra called a sphincter muscle that helps keep it closed unless we're trying to empty our bladder in the bathroom. So imagine when you're laughing, coughing, sneezing, and the bladder gets squeezed and urine is trying to come out, the urethra can push against that pelvic floor support and get kinked and close. In addition, those sphincter muscles that I talked about around the urethra, they can also help close the urethra. But what happens for women with stress urinary incontinence is that this support is weak. So now when the bladder is squeezing, the urethra doesn't really close against that support because this support is weak. And also for a lot of women, the sphincter is damaged, so it keeps the urethra open and urine comes out. An analogy that I often give my patients in the office is, think about the urethra as a water hose. If the water hose is on the floor and water is leaking and you try to close that water hose, you step on that water hose. If the floor underneath is hard, the water hose will just kink and then the water will stop flowing. But imagine if that floor, instead of being a hard wooden floor, is sand or soft clay. Now when you're stepping on that pipe to close it, instead of the pipe kinking against that hard floor, because the floor underneath now is soft with that soft sand, everything just sinks. So the urethra, or the pipe in this case, stays open and you have leakage. So then the next question may be, well, why is the pelvic floor weak? Well, there are many factors, but for a lot of young women, just like Sarah, who I talked about earlier, a lot of it starts with pregnancy and childbirth. Trauma from childbirth, any kind of injury to that pelvic floor muscles, chronic constipation, chronic cough, being overweight, genetics, any kind of surgery or damage to that pelvic area, radiation to the area for cancer patients, anything that can damage the pelvic floor muscles or cause nerve damage or muscle injury to that area can make women more susceptible to stress urinary incontinence. In addition, age, so hormonal changes for women going through menopause can be another trigger. But here's the good news. Stress incontinence is one of the most treatable conditions. And the good news is there are so many amazing treatment options, many of which are non-surgical. And even when we're doing surgery for patients with stress incontinence, these are minimally invasive procedures that are literally 10 to 15 minutes. Patients go home the same day. Recovery is very minimal, and overall patient success rates can be 90% and higher. So what can you do about it? The first thing I tell patients is awareness. Know and believe leaking here and there is not a normal thing. It is a common thing, and another statistics that I often use with my patients is 1 in 3 women will have urinary leakage. Many women early in their 20s. If somebody has had 3 or 4 babies already, by the time they're in their late 20s, they may notice urinary leakage as early as in their 20s. And I have many patients who are well into their 80s and 90s. Maybe they've been suffering with this for a very long time, but never quite realized that there is treatment for this. Now, when we talk about treatment for urinary leakage, just like anything else, there are conservative treatment options, meaning non-surgical. And of course, if you want something more definitive, then surgery is the more definitive option. What are some conservative options? Things like pelvic floor exercises to strengthen those pelvic floor muscles. You may have heard about Kegel exercises, but very important is to do those Kegel exercises correctly with the correct form, isolating the right muscles. So oftentimes I will recommend that my patients work with pelvic floor physical therapists so that they can guide you, individualize your treatment session, and make sure that you're getting the most of your workouts. But remember, pelvic floor exercises is just like exercises for any other part of the body. It does take time. It does take patience. You don't go to the gym one day and expect a 6-pack abs, right? It's not how it happens. So similarly, with pelvic floor exercises, make sure you're doing them correctly, you're using the right form, you're consistent. Don't give up hope. It does take 3 months before you start noticing some improvement, but if you're consistent, you will see it. Number 2 is avoiding risk factors. Remember, we talked about obesity, chronic constipation, chronic cough as being risk factors. So addressing those risk factors can be really beneficial. Similarly, for my patients who are menopausal, using some vaginal estrogen cream can really help improve the texture of the tissue, can help improve the consistency of your muscles, can help improve some of your urinary symptoms, and can also help with stress incontinence. There are also vaginal inserts, things like pessaries, as well as something called impressa, which is a vaginal insert that looks like a tampon. And the idea is both the pessary and the impressa, when you insert it into the vagina, they push against the urethra and supports it. You may have heard about pessaries in the context of prolapse, but believe it or not, pessaries can also be a treatment option for stress incontinence. Let me know in the comment section if you want me to make a separate video about pessaries, and I'll be happy to do so because there's so much to learn about pessaries, how we use them. So let me know if you're interested. And finally, for those who want a more definitive treatment, there are some amazing minimally invasive treatment options that I offer my patients. The first and most common surgery that we do for stress incontinence is something called a sling procedure. And I recently made a whole video about sling procedures by itself. If you haven't already, definitely check it out. I'll put the link in the description below. In addition to sling procedures, there are other procedures like a bulking injection, which is kind of like cosmetic fillers. So think about using fillers, but for the walls of the urethra so that the walls can thicken and then the hole through which urine comes out can narrow down. And that can also significantly improve stress incontinence symptoms. In addition, for patients who may not want mesh surgery, there are sling procedures that we can do using your own body tissue. There are also some other abdominal procedures as well, where we use sutures or stitches to help support your urethra a little bit better. So long story short, if you're somebody who's suffering with stress incontinence in 2025, there's absolutely no reason to think this is your new normal. Whether you want surgery, whether you want conservative treatment options, there is something for everyone. So don't wait any longer. Try to see if you can see your urogynecologist, somebody who treats women with stress incontinence all the time, because then we can talk to you about all the different options, do a thorough exam, identify your pathology correctly, and get you the treatment so you can live your life to the fullest and not have to cut down on things you used to enjoy before. Hope you found this video helpful and educational, and if you did, don't forget to hit the subscribe button. Please, please, please do share it with somebody else because so many women are suffering in silence. This could be a way you could help somebody who absolutely needs to hear this. I'll be back again in a few days with another good video about your pelvic health. So till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye.